Is herbal medicine just a fad, or is there real science behind it? For centuries, plants have been used to treat illness, boost vitality, and maintain balance. But in today's world of synthetic drugs and clinical labs, is there still a place for these natural remedies? Forget everything you thought you knew about herbal medicine. We're diving into the biology, chemistry, and history behind plant based healing to separate myth from medicine and reveal what science says about the power of herbs. Herbal medicine has been with us since the beginning of human civilization. Ancient Egyptians wrote of healing herbs on papyrus scrolls. In India, Ayurvedic practitioners developed detailed plant based systems of care. Traditional Chinese medicine, still practiced today, is rooted in over 2,000 years of herbal knowledge. Yet, despite this long history, herbal medicine is having a modern revival. Across the globe, more and more people are turning away from purely pharmaceutical options and embracing natural remedies. Why? Concerns about the side effects of conventional drugs, a growing interest in wellness and holistic health, and a cultural shift toward reconnecting with nature. According to the World Health Organization, over 80% of the global population relies on herbal remedies for some part of their healthcare. Whether it's sipping chamomile tea for sleep or adding turmeric to a smoothie, herbal medicine is being rediscovered. But the question remains, is it effective? To understand herbal medicine, we need to look at what makes plants so powerful. And that starts with phytochemicals. Phytochemicals are natural compounds that protect plants from disease and predators. But in humans, some of these same compounds can reduce inflammation, combat oxidative stress, and even fight infections. Take turmeric, for example. Its golden color comes from curcumin, a compound shown in studies to ease joint pain and support brain health. Or ginger, used for centuries to calm nausea. Modern science has revealed that gingerol, its main bioactive compound, also has anti-inflammatory and antioxidant effects. Then there's ginseng, an adaptogen with potential benefits ranging from increased energy to improved mental clarity. Its key compounds, called ginsenosides, interact with the central nervous system and immune cells. These aren't just traditional beliefs. In lab settings and clinical trials, these compounds are being tested and, in many cases, validated. Herbal medicine is starting to earn its place in the realm of evidence-based practice. Herbs actually work inside the body. At the cellular level, phytochemicals bind to receptors, alter chemical signals, and influence the body's own healing systems. The effects can be surprisingly complex. Some herbs reduce inflammation by blocking enzymes like COX2, the same ones targeted by ibuprofen. Others act as antioxidants, neutralizing harmful free radicals that can damage cells and DNA. Adaptogenic herbs, like ashwagandha or rhodiola, help the body regulate stress by modulating cortisol and balancing the hypothalamic pituitary adrenal axis. Other compounds support the immune system, enhance liver detoxification, or influence neurotransmitters like serotonin and dopamine. When seen through the lens of modern science, herbs become less mystical and more biochemical. They don't just help us feel better, they interact with our biology in very real ways. Still, herbal medicine is not without risk. Because they're natural, many people assume herbs are always safe. But that's not true. Some herbs can cause allergic reactions. Others can interact dangerously with prescription medications. St. John's wort, for example, is often used to ease depression, but it can interfere with birth control pills, blood thinners, and antidepressants. The lack of regulation in many herbal products also means you can't always be sure of dosage, purity, or consistency. What's on the label may not be what's in the bottle. That's why medical professionals recommend using herbs wisely, as part of a bigger picture of health, not as replacements for conventional care. Herbs can be powerful allies, but like all powerful tools, they must be used with knowledge, respect, and responsibility. What lies ahead for herbal medicine? In labs around the world, researchers are mapping out how herbs work. down to the molecular level. Clinical trials are exploring their effects on everything from anxiety to liver disease. And pharmaceutical companies are now studying traditional herbal formulas in the search for new, safer drugs. The next frontier? Personalized herbal medicine, tailoring plant-based treatments to individual genetics, lifestyles, and health profiles. With AI and big data, the future of herbal therapy could be more precise and powerful than ever before. But this future depends on science, ethics, and access. The goal isn't to replace pharmaceuticals. It's to find harmony between nature and modern medicine. Medicine stands at a crossroads between ancient wisdom and cutting-edge science. With every study, we learn more about how plants heal, not through magic, but through molecules, not through myth, but through measurable biological action. This isn't just history, it's happening now. And the more we understand the science behind herbal medicine, the better equipped we'll be to use it wisely, safely, and effectively. This is Depth Scope, where curiosity meets clarity.